In this lesson, you will learn what artificial intelligence actually means in the context of healthcare, how it is already being used in hospitals and clinics around the world, and why healthcare professionals need to understand it even if they never write a single line of code. By the end, you will have a clear picture of where AI fits into modern medicine and, just as importantly, where it does not. This is not a coding lesson. It is a practical orientation for people who see patients, read scans, write notes, and make decisions every day. Let's start with the basic question that gets skipped far too often. What is AI, really? When most people hear artificial intelligence, they picture robots or science fiction. In healthcare, AI is much more practical. At its core, it refers to software systems that can analyze data, recognize patterns, and make predictions or recommendations. Tasks that would normally require human intelligence. The type most relevant to you today is machine learning, a subset of AI where algorithms learn from large datasets. You have already used it without noticing. Spam filters in your email, autocomplete on your phone, and recommendation engines on streaming services all run on machine learning. In healthcare, the same principles apply, but the stakes are much higher. Instead of recommending movies, these systems help radiologists spot tumors, predict which patients are at risk of sepsis, and generate clinical notes from doctor-patient conversations. AI is not a future promise, it is deployed right now. Start with medical imaging. Tools from companies like ADOC, Viz.ai, and Google Health analyze CT scans, X-rays, and MRIs to flag abnormalities. The FDA has cleared over 700 AI-enabled medical devices, with radiology leading the pack. These tools do not replace radiologists. They act as a second set of eyes, catching findings that might slip past during a high-volume reading session. Then there is clinical documentation. Ambient AI scribes like Nuance DAX Copilot, built in partnership with Microsoft, and Abridge listen to the doctor-patient conversation and automatically generate structured clinical notes. For many physicians, this cuts documentation time by 50% or more, which directly attacks the burnout crisis driven by endless charting in electronic health records. Two more areas where AI is live today. First, predictive analytics. Hospital systems like Epic and Oracle Health, formerly Cerner, embed AI models that predict patient deterioration, readmission risk, and sepsis onset. These early warning systems buy clinical teams something priceless: time to intervene before a patient's condition worsens. Second, drug discovery. Companies like In Silico Medicine and Recursion Pharmaceuticals use AI to identify drug candidates in a fraction of the time traditional methods require. This one is less visible if you work at the bedside, but it is quietly accelerating the pipeline of new treatments that will eventually reach your patients. So across imaging, documentation, prediction, and discovery, AI is already woven into the system you work in, whether or not anyone told you. You do not need to become a data scientist, but you do need to understand AI well enough to do 5 things. Evaluate the AI tools being introduced at your workplace. Interpret AI-generated recommendations rather than blindly accepting or rejecting them. Advocate for your patients when a system may have limitations or biases. Communicate with the technical teams building and deploying these tools. And stay competitive in a healthcare landscape that is changing fast. Here is the number that captures the shift. A 2024 survey by the American Medical Association found that 65% of physicians see advantages in using AI in healthcare, up from 38% just 2 years earlier. That is not a slow drift. That is an adoption curve accelerating under your feet. It is equally important to know the limits. AI cannot replace clinical judgment. It can surface patterns and recommendations, but a physician's training, experience, and understanding of the individual patient remain essential. AI can be wrong. Models trained on biased data produce biased outputs, and a system trained mostly on one demographic may perform poorly for others. AI does not understand context the way you do. It processes patterns in data, not the lived experience of the patient sitting in front of you. And AI requires oversight. Every AI recommendation in a clinical setting should be reviewed by a qualified professional before any action is taken. Hold those 4 limits in your head every time a vendor demo makes something look effortless. So, the most effective model is not AI versus clinicians. It is AI plus clinicians. Think of AI as a highly capable but imperfect colleague. It can process thousands of data points in seconds, but it needs your expertise to interpret those findings within the full context of patient care. Hospitals that have successfully integrated AI report better outcomes, not because they replaced human decision-making, but because they augmented it. The radiologist using AI assistance reads, scans faster and catches more findings. The physician using an ambient scribe spends more time with patients and less time typing. To recap, AI is software that finds patterns and makes recommendations. It is already live in imaging, documentation, prediction, and drug discovery. It has real limits, and it works best alongside you. Now put this to work. Pick one of the 4 areas we covered: imaging, documentation, predictive analytics, or drug discovery, and ask an AI assistant to explain how it would apply to your own specialty and daily workflow. Then push back on the answer using the limits from this lesson. Ask where the model could be biased, what context it would miss, and who should review its output before anyone acts on it. That habit, accepting nothing at face value, is the whole skill. You can do this right now on the lesson page at FreeAcademy.ai using the interactive prompt playground, or by pasting your questions straight into an AI assistant like ChatGPT or Claude. Try it, then move on to the next lesson in the course.